So I'm an actor and producer living with severe hemophilia, and for the past few years I've been the president of a digital content agency that does a lot of work for the bleeding disorders community. And we don't just produce the content, but we work directly with our supporters to identify the major needs that our content is addressing, and we engage directly with the community to ensure that we're always listening to their input and feedback. The World Federation of Hemophilia's humanitarian aid program is the program that serves the developing world and seeks to make factor products, diagnostic services, and training sessions available to patients and clinicians in the developing world. In the first 20 years of World's humanitarian aid program, in total, the program distributed 270 million international units of factor, which is incredible. But this expansion that they are going through right now is as a result of a 500 million unit donation that is coming over the course of the next 5 years. So WFH engaged us to help tell the story of their humanitarian aid program, what it's doing around the world, and why it matters. At first it seemed to me that the directive was pretty simple. We have factor in the developed world, let's just send it to the developing world. But the process is far more complex. How is it shipped there? How is that paid for? Where is the product stored? Who is in charge of the HTC or storage facility? What is the level of government involvement? Is the government going to tax the donations that are brought in? Do community advocates have relationships with government officials? If so, how do we grow those? And if not, where do we start? Over the course of our trip, we met all kinds of incredible community members living in the developing world. A parent of a newly diagnosed child, a young man who excitedly recounts the first time he received factor, an exhausted mother who fights tirelessly to provide for her children. You'll hear from each of them through the course of this series, as well as from some of the fantastic leaders in the bleeding disorders community around the world. There's people like Dr. Saliou Diop, who is the medical director of the only HTC in Senegal. He has been instrumental in not just working with World to arrange for factor donations, but in having a treatment center in Dakar, Senegal to begin with. When he started, there was no center. You'll meet people like Assad Haffar, who speaks, I think, 5 languages, has a photographic memory, and is essentially the Energizer Bunny of WFH's humanitarian aid program. And we'll meet Matthew, a man who lost a 5-year-old son to what he later learned to be hemophilia, which his 2-year-old son was diagnosed with having only a few months before we met him. Matthew gave us an incredible window into the lives of community members in the developing world. And then there's Adediran, a mother of boys with hemophilia with a particularly captivating personal story. But what's interesting to me about Megan is that in response to her story, she set up the Hemophilia Foundation of Nigeria. When she first found out about her son's diagnosis, she knew nothing about hemophilia, there was no local organization, there was nothing that the local hospital knew about hemophilia. And this is in a country of 175 million people. So if we accept the guideline that hemophilia occurs in approximately 1 in 10,000 births, that means that there are over 17,000 people with hemophilia living in Nigeria. And even now in 2016, we only know of about 240 of them. So the challenges in the developing world are clearly vast. It's not just a matter of factor supply. It's a matter of adequate diagnosis, adequate infrastructure to support the management of hemophilia, advocating with governments to understand what hemophilia is and how they can support their citizens with bleeding disorders. And we are dependent as a community on people like Megan, like Saliou, and like Assad, who are leaders working tirelessly every day to improve the lives of people with bleeding disorders in the developing world. My hope with this series is that people watching it, especially people affected by bleeding disorders, lean in and recognize that the folks they are watching are community members too, and they face immense challenges. But there is an organization, the World Federation of Hemophilia, with a dedicated humanitarian aid program striving to improve the care and lives of people with bleeding disorders all around the world. And I hope that once you've watched this video series, you'll take action. Do some reading, ask questions, engage with WFH. If you can give money, that's great, of course. But if you can't, there are other ways that you can be an active community member striving to make changes in the developing world. And frankly, for people like me, I think it's our duty as community members who just so happen to have been born in the developed world to care a little bit more about those who were not. Hey, thanks so much for watching this video from the WFH Humanitarian Aid Program series. If you'd like to watch more videos from the series, you can click here, or you can click here.